The critical link between periodontal disease and acute periapical abscesses. Insights for healthcare professionals. Welcome to our channel. Did you know that over 400,000 emergency department visits in the US are attributed to dental issues, with acute periapical abscesses (PA) being a significant contributor? Today we will explore a critical connection between periodontal disease (PD) and the prevalence of acute PAs. Understanding this relationship is vital for healthcare professionals aiming to provide comprehensive dental care. Let's dive into the key findings from a recent study that sheds light on this important topic. The study revealed that patients with PD have a significantly higher incidence of acute PAs compared to those without PD, with an odds ratio OR of 46.2. This means that individuals with PD are nearly 46 times more likely to develop acute PAs. The data showed that women and older patients were particularly affected, highlighting the need for targeted interventions in these populations. Now that we understand the prevalence, let's examine the underlying mechanisms that contribute to this alarming trend. The pathways for infection between the periodontal tissues and the dental pulp are crucial to understanding this relationship. The study identified several routes, including dentinal tubules, lateral and accessory canals, and the apical foramen. When the cementum layer is compromised, these pathways can facilitate the spread of bacteria from periodontal pockets to the pulp, leading to inflammation and necrosis. With these mechanisms in mind, let's discuss the role of systemic factors that can exacerbate these conditions. Diabetes and smoking were identified as significantly comorbidities that increase the risk of both PD and acute PAs. Diabetes can heighten inflammation and impair healing, while smoking alter oral flora and reduce blood supply to the alveolar bone. Even after adjusting for these factors, the study found that the association between PD and acute PAs remained strong, indicating that PD can independently contribute to the development of acute PAs. Understanding these risk factors is essential, but what about the implications for clinical practice? Given the strong association between PD and acute PAs, healthcare professionals must be vigilant in diagnosing and managing periodontal conditions. Regular screening for PD, especially in at-risk populations such as older adults and those with comorbidities, can lead to early intervention and potentially prevent the development of acute PAs. Additionally, educating patients about the importance of maintaining good oral hygiene can significantly impact the overall health. Now, let's consider the limitations of this study and how they might affect our understanding of this issue. While the study provides valuable insights, it is essential to recognize its limitations. As a cross-sectional study, it cannot establish causality. Furthermore, the quality of dental restorations and endodontics treatments was not assessed, which could influence the outcome. Further research should focus on longitudinal studies to better understand the causal relationship and explore the prevalence of PD in patients who do not seek emergency treatment. Finally, let's summarize the key takeaways from our discussion today. In conclusion, the evidence clearly indicates that patients with periodontal diseases are at a significantly higher risk for developing acute periapical abscesses. Understanding the mechanisms of infection, the impact of comorbidities, and the clinical implications is crucial for healthcare professionals. By prioritizing periodontal disease, we can improve patient outcomes and reduce the incidence of acute PAs. Thank you for joining us today, and don't forget to subscribe for more insights into dental health and patient care.